Well, the warning signs is when people maybe have swollen feet or ankles, or maybe they feel nauseous, or they feel tired, or maybe they're very itchy, they have a lot of itchiness. There are quite a few symptoms. The thing is that often people relate them to something passing by or to something else which they may have, and they don't look into it more than perhaps they should. But I mean, in order to find out whether you suffer from a kidney condition or any other, a very easy way to find out about it is to have a blood test or a urine test, and it will show there, and it's as simple as that.
What can people do to make sure their kidneys stay healthy?
Well, in my view, there are three main factors, or three things that we should do. Obviously, having a low salt diet and generally having a healthy diet with more vegetables and fruits. Low protein, because obviously protein creates creatine, which increases your creatinine in the blood. The second one, obviously, is exercise. A simple half an hour walk goes a long way, because that also has a positive impact on your blood sugars and your blood pressure, because both high blood pressure and diabetes can cause kidney disease. And the third one, which I think is very important, is drinking plenty of water to keep your kidneys hydrated, to keep yourself hydrated, because obviously water assists in the filtration of the toxins in the blood, which obviously go through your urine.
The Health Minister recently said the number of patients receiving kidney transplants continues to grow, and that work on the expanded dialysis unit is going well. So how happy are you with the progress so far?
As president of the charity, in terms of the dialysis unit, expansion, and it's fantastic. From having 6-7 beds going up to 14, it's great. The latest technology, the latest machinery is going to be in there. So as a charity, we are over the moon. We're really, really happy. In terms of transplantation, I'm going to leave that to Dominic to answer, because I think he's the right person to do so.
Yes. Well, as regards transplantation, I was fortunate enough, and I was called up, and so have a few others this year. So it shows that the agreement the government came into with the NHS a little while back is working for a change. So we're very happy with that, and with the care and attention we have received whilst in Gibraltar and also whilst in the UK. It's very difficult to falter. I don't think you can, to be honest.
Now, this is taking place against the backdrop of the developing coronavirus crisis, and it has been pointed out that this is particularly worrying for people who are immunologically compromised. So what is Kidney Care Gibraltar doing to respond to this?
Well, I think from a charity's perspective, we are there to assist any patients, any members, anyone in the community who's not very sure what to do. I think the GH have been very proactive and are taking steps to mitigate whatever risk, obviously, as patients who are on dialysis, on medication, immunosuppressed, diabetes, blood pressure. We are, as a matter of fact, higher risk, but we are obviously looking at the advice, and I know that the doctors, having spoken to Dr. Lyons this morning, everything is being done to mitigate and reduce any risk to kidney patients generally.